Well, I've been attending Psych Congress since 2008, but I've been in sort of an unusual position because when I started attending Psych Congress, I also became part of the steering committee for the Congress. So I kind of, when I landed at Psych Congress's door, I immediately got extremely involved in thinking about how to organize it, how to think about the educational material. So, I think what I've seen over the last 4 or 5 years is really, there's always been great things at Psych Congress, but the consistent quality of the talks and the ability to really focus on taking scientific stuff and making it as clinically and practically relevant as possible, that ability, that tendency has really, I think, gotten stronger and stronger over the last 3 or 4 years. If somebody hadn't attended Psych Congress before, I'd say, there really is no other meeting like it, not in psychiatry, and I'm not sure in mental health more generally, a meeting that manages to incorporate cutting-edge science, but always doing it with an eye towards clinical applicability. Right? So, if you look at, there's other great meetings, but they're often either more specialized in a topic area, or they're a large society meeting, and many of those meetings, they have interesting pieces, but they're all bits and pieces, and they're often either completely clinically focused or completely research focused. The thing that's so unique about Psych Congress is, again, that all of us that are involved in crafting the content, for every talk, make this commitment to trying to find out what's on the cutting edge of what we know about a topic, and then how does that translate back into improving clinical care? And that, I think, is the thing that's unique about Psych Congress. And I think it's why so many people that come for the first time are, often are just blown away. So I think one of the things that makes Psych Congress so interesting is that it's a really rich, complex event, right? So first off, we call it a Congress, but as I've been, chairman for the last couple of years, and I've been on the steering committee now for, I think, 4 years, and what has really become apparent to me is that Psych Congress is also a community. It's a community of clinicians that has a lot of stability over time. There's always new people coming in, and but there's this, so it's got this community sense to it that gives rise to, I think, an exchange of information at all sorts of levels, right? So it's not just that people learn in the courses, but people actually learn a lot from each other. There's a lot of dialogue. I think that makes it really unique. The other thing that makes it unique is that there really is an array of activities, right? So like most meetings, we have standard lectures. And like many meetings, we have a really cool exhibit hall so people can come and get a sense of what the up-and-comers are in terms of new treatment modalities. But then we have things, I think, that are really unique. So for instance, in the exhibit hall, it's not just exhibits. We have these Meet the Experts series where people can come and, those of us that are doing some of the talking around here will come and spend a half hour and just answer people's questions, talk with people, interact with them. I think people, I know I treasure that when I get a chance to sit with folks that know more than I do about something that's important to me clinically. And then I think the other thing that's really fascinating is that in addition to lectures, we have things like, meditation groups, right? So Sandra Jen, who is really an expert at wellness and how to apply behavioral things like meditation to mental health, leads meditation groups you can sign up for. And it's a lecture, but it's also a practice session. And that is very, I think, unique. And then finally, we have a number of discussion groups. We have case series where you can come and sit at a table with a world-famous clinician or a world-famous researcher and, kind of duke it out about what would you do about this case and back and forth. And so again, I think that the overarching theme that makes Psych Congress so unique is that at every level, it's really such an interactive event. Yeah, I'm an unusual psychiatrist. there aren't very many psychiatrists that are in a school of agriculture, and I do a lot of strange and unusual things. I'm a clinician, but I'm also largely a researcher, and I study things that are sort of out on the far edge of what we know about mental illness. So you wouldn't think that I would be somebody that would be as likely to be impacted by Psych Congress as, say, somebody that's really every day down in the trenches, seeing tons and tons of patients. But it is remarkable how powerfully my research which is really looking at some new and unusual things, how powerfully it's been affected by my interactions with the thought leaders at Psych Congress, right? So, I mean, my colleagues Vlad and Rakesh have profoundly altered how I think about, mental illness and mental wellness. And much of the work we do that's fairly high-profile research, with a lot of big grant support and it gets a lot of publicity. People would be amazed if they knew how much of what I decide to do and how I decide to think about things over the last 5 or 6 years has been crafted by things that have occurred in and around Psych Congress. So even for somebody like me that has a most unusual practice, a most unusual profession within mental health, the Congress has been really transformative in my thinking about things. So, I'm involved in a lot of sessions. And I mean, if you just looked at the number of sessions that I say something in, it runs to many, many. So much of the day at Psych Congress for me, unfortunately, I have to listen to myself talk, But I also get a chance to sort of slip in and out and observe other sessions. So let me give you an example of a session that I found fascinating. So I'm not an addiction psychiatrist. I don't specialize in substance abuse. I went to listen to this fantastic talk about substance abuse, and I was sitting in the back of the room, and I was just blown away at how the speaker had such a sophisticated grasp of what is addiction really, and he was speaking about how the use of alcohol or drugs is really, it's not the disorder, it's a symptom of the disorder, that the disorder arises from this combination of fairly predictable environmental factors, especially early in life, and some genetic factors. And as he was talking, I thought, it is amazing to me that this gentleman, who I'd never met, is articulating a vision of substance abuse, addiction problems, that exactly overlays and is concordant with a lot of what we now understand about the causes of mental illness in general. I mean, I know a lot about this, right? So I have a certain kind of unique perspective. And I was just amazed, that he wasn't just sitting there, going through some checklist or parroting off, sort of old tired stuff. He was offering this remarkable synthetic cutting edge view, but he didn't leave it there. Then he started talking about, given that this is what is at the essence of these disorders, here are things you can do to more effectively treat them. And like I said, I wandered in, I sat down, wow, it was just a really thought-provoking session. And it's an example of what a lot of sessions here are like. So I'm a member of the steering committee, and when people ask, well, how accessible is the steering committee? Of course, I've got a dog in that fight, but I also have a chance to see it at very close range. And I think one of the things that really distinguishes the Psych Congress is that the steering committee and some of the key thought leaders are remarkably accessible. I mean, some of us are more outgoing than others, and the most outgoing of us can't get 3 feet down the hallway without being stopped. I mean, my colleague Dr. Jen, who is really such a gifted teacher and clinician, you can't plan to do anything with him around here because he can't get from room A to room B. He almost needs a bodyguard because he's so accessible, and people, he'll spend 3-4 hours a day just trying to get around here as people talk to him, and yeah, I'm a little bit shyer by nature, but it's amazing how often people come up to me, they talk to me. So I was walking to this taping session, and I started up this long conversation with a psychiatrist from Ohio. We were talking about this and talking about that. So I think that's also part of it. At many meetings, the people that are doing the talks they're sort of like VIPs, and they come in and they're sort of off by themselves, and they do a big talk, and then they're gone. And Psych Congress is not like that, man. I mean, we who are on the steering committee, we roll up our sleeves, we're here all the time, and we see as an essential part of our job being available to talk with people. I get complaints about the air conditioning, I get complaints about the sound system, but I also get lots of discussion about, well, what did you mean about such and such, and what was Dr. Jen or Dr. Malatek or Dr. Thace talking about? So it's very, that's one of the great things. We've talked a little bit as you've been asking me questions about how Psych Congress is a community and how it is at its essence this sort of powerfully interactive event. And again, as a member of the steering committee, it gives me this unique perspective that we are so deeply involved in that interactive process that I think it's one of the real, again, distinguishing features that makes Psych Congress so clinically valuable to people. 2013 is going to be a great year for people that haven't come to Psych Congress before. Of course, it's going to be a great year if you have been coming to Psych Congress, but you know, it's just, this year was a great Congress. I mean, we've had great Congresses for the last several years, but this one was really a standout. And, you know, because I'm so involved in thinking about what 2013 is going to be, again, I've got this kind of privileged opportunity to be able to look down the road, and it's going to be a fascinating meeting, right? So, I mean, one of the things that's developing in psychiatry is that in the next 2 or 3 years, there's going to be a whole handful of new medications for a variety of disease states. And some of those medications have fairly unique and new, novel mechanisms of action. In addition, you know, DSM-5, the new psychiatric diagnostic book, is coming out within the next year. And whatever it is, it's going to be different, and that's going to cause all sorts of challenges and opportunities. So one of the things we're really focusing on for 2013 is designing content that will prepare clinicians to really be able to optimally utilize, take a hold of these new developments, new therapeutic developments, new diagnostic developments, how to think about them, how to understand them. So I think it's going to be, I think 2013 is going to be a watershed year, a real landmark year, because we're going to be able to help people really get at the top of that wave that's coming of new lots of stuff. And so, you know, it's just, you know, I tell people, boy, you know, next year, if you really want something where it's going to be bang up. And so, you know, we're really excited about it.